Welcome to today's webinar on newly covered services in the statewide managed care program. In the SMMC program, the health plans are responsible for covering services that were previously provided through the fee-for-service delivery system. These services include early intervention services, EIS, medical foster care services, targeted case management, and nursing facility services covered by the managed care plans, the MMA plans. Early intervention services. This presentation will focus on what early intervention services are and who receives those services and who provides those services. And most importantly, why these services are being integrated into our SMMC program. These services are being integrated for complete coordination and service delivery to make sure that they're fully able to provide comprehensive care to children who have special health care needs. What are EIS services? EIS services are services provided to recipients ages 0 to 3 who are at risk or who have developmental delays. The point and intent of the services are to provide family support and to help the child meet necessary functioning, specifically for children who have been identified as having a delay or suspicion of having a delay. The intent of the service is to make sure that these children are able to perform at developmental milestones with their peers who do not have delays. Early intervention services include several things. First is a screening. The screening is a service provided to identify if there's a need for a more intense assessment. The screening can be completed by anyone to make a determination whether EIS services are appropriate for a child. Then there are evaluations. Evaluations are performed by a multidisciplinary team to identify the presence of a developmental delay. EIS sessions. EIS sessions are face-to-face visits with a child and that child's parent, legal guardian, or a caregiver. These sessions are designed to provide the family or the caregiver with services to support them in ensuring that their child, who may have a delay or has a suspicion of a developmental delay, meet their optimal growth. Here's an example of what early intervention services are.
Early intervention visits occur in the home, outside in the backyard, in the community, or during the daily activities in child care settings. Intervention visits are the times when you, the important adult in the child's life, partner with early interventionists to figure out the best way to help children learn and develop. It is also the time to work on other goals the family wants early intervention to help with. Many families and care providers ask, what do intervention visits look like?
Early Steps. Early Steps is the Florida Early Intervention Program that offers services to eligible infants and toddlers who are at risk for developmental delays or have developmental delays. The Early Steps supports families and caregivers by increasing their child's participation in their daily activities and routines. Currently, Early Steps has 15 local offices that provide these services. Here's a brief clip to show you an overview of the Early Steps program.
The Florida Department of Health Division of Children's Medical Services is the state lead for Part C of the Individuals with Disabilities Education Act. The name of Florida's program is Early Steps. Early Steps provides support for families of infants and toddlers who have developmental disabilities or delays. We serve children from birth to their 3rd birthday. Early intervention is critical for infants and toddlers with unique needs and delays. Research shows that children's earliest experiences play critical roles in brain development. Early Steps honors the strengths, beliefs, cultures, and values of families and helps them build on a child's individual strengths. Our program supports infants and toddlers where they live, learn, and play.
Part C, Individuals with Disability Education Act. The Early Steps program is overseen by federal law, and it's referred to as the Individual with Disability Education Act. This is to provide services for children who have disabilities or suspicion of disabilities, access to free and appropriate education. Specifically, it's geared to children 0 to 3 who have developmental delays or disabilities. This program is administered through the Department of Health. The features of Early Steps. Early Steps, as identified in the presentation, the video, bring services to the child's life. The intent of this is to provide service in the child's natural environment, to offer opportunities of learning through everyday routines, specifically to allow the child to be able to meet developmental milestones consistent with their normally developing peers. The intent of Early Steps is to allow parents to become their child's first teacher and to continue to offer supports and work with the families and caregivers. Early Steps supports family and caregivers in many ways. They support family and caregivers by helping them with daily interactions and routines, things that may seem ordinary but help that family grow and strengthen that child's development, such as bath time, bedtime routines, activities of daily living like independent care, and other activities. Currently, the Early Steps has 15 local offices that are referred to as the local Early Step offices, and they're throughout the state. The LESs have contractors, and they also have providers who provide the care. Here's a list of the Early Step service areas for reference. Early intervention services, which are a part of the Early Steps program administered by the Department of Health, operate from a paradigm of prevention and intervention. Florida Medicaid offers services through a medical model. It's important to understand that there are two different paradigms, specifically when recognizing these services. EIS utilizes an intervention and prevention model, meaning that the goal of this service is to make sure that services are in place to make sure that higher-end services are not needed. The intent is to reduce developmental delays and therefore reducing medical cost. This means that if a child has a suspicion of services or a suspicion of a need, the services are supplied before there actually is a need to provide the services. Core components of the Early Steps program. It's important to know these core components because these are the standards that the Early Steps program is held to. As EIS services are a component of that, it's important that those EIS services are in place when necessary. Federal law requires that 45 days from a referral that services begin. The law that governs the Early Steps program and EIS services is Title 34 CFR 303.301. Specifically, it identifies what must occur in that 45-day time frame and what things must be documented. We'll speak a little further on about the Individual Family Support Plan. Here's a picture of the Early Steps program. Day 1 is the first day of referral, and day 45 is when services are in place. There are a lot of things that must occur to be able to have these services in place for a child who needs those services. A referral can be made by a parent, a caregiver, preschool teacher, a physician, or any other person in that child's life. From that point, a screening may be conducted. From the screening, then an evaluation is provided. And from that evaluation, then a multidisciplinary team is gathered to complete a staffing to develop the Individual Family Support Plan. Once the Individual Family Support Plan is in place, services then may take place. The Early Steps program and EIS services are focusing on the following developmental domains: physical, which is moving, walking, grasping, coordination, hearing, and vision; cognitive, thinking, learning, and problem solving; communication, babbling, language, speech, and conversation; emotional and social, playing and interacting with others; adaptive environment, self-help skills, or activities of daily living, or maintenance skills. Documentation. Florida Medicaid requires the following documentation for early intervention services. The first document that's required is the Individualized Family Support Plan. Additionally, progress notes and a plan of care. The Individualized Family Support Plan can suffice as a plan of care when all components are met in that document. What is the Individualized Family Support Plan? The Individualized Family Support Plan, referred to as an IFSP, is a guiding document. It also is the authorizing document for all services. Services that are listed on this document must be provided in accordance with federal law. This document is tailored to each child, and it specifically will address the goals and objectives as described by the parent or caregiver in that meeting. Additionally, it identifies resources, priorities, concerns, and the type of services that are necessary to support that family and that child in meeting optimal development. Here are the key components of the IFSP. Additional information about the IFSP can be found at the Early Steps website, and the link is included. Progress notes and plan of care. Providers are required to maintain progress notes that include specific information related to the service. This is a Medicaid requirement and is described in the Medicaid policy in our Early Intervention Services policy. A plan of care. As addressed before, the plan of care can be the IFSP if all required components are met. Specifically, the components listed below are the components that must be identified in the IFSP to be counted as a plan of care. Who can provide EIS services? EIS services can be provided by a number of professionals. Most importantly, the infant toddler developmental specialist that is certified by the Department of Health, and practitioners who are licensed within their scope of practice in Florida. The list of practitioners who are able to perform these services are extensive, from nurse practitioners to audiologists to speech and language pathologists. Additional information on who can provide the service is found in our EIS policy. The Infant Toddler Developmental Specialist Certification. The Department of Health offers a special certification for providers who have a specialized focus on meeting needs of children with special healthcare needs or developmental needs. For information about training, it can be found on CMS's website, Department of Health CMS's website. The health plans are obligated to have in their network infant toddler developmental specialists who are eligible to perform early intervention sessions in accordance with the coverage policy under Florida Medicaid. Procedure codes and fee schedule. The following are a list of procedure codes and fees that are associated with the EIS program. These are the codes that are billed when performing an early intervention session. These sessions are provided by the professionals that we spoke of above. The plans are obligated to pay these procedure codes for these services. Plan responsibilities. The health plan is responsible for a number of things. Specifically, the health plan is responsible for ensuring a smooth transition and making sure that there's access to needed services. Most importantly, built into the health plan's contract are the following areas: screening and evaluation services. In the health plan's contract, screening and evaluation services will be identified as an area that the health plans must focus on to make sure that there's appropriate access. Multidisciplinary team meetings, service delivery models, authorization, care coordination, provider network, and continuity of care and provider reimbursement. Those are core areas. Screening and evaluation services. Screening and evaluation services for early intervention sessions are not prior authorized. This information will be contained in the health plan's contract, as the agency is committed to making sure that services are available for children when they need them, and consistent with meeting the federal requirements of that 45-day time frame. Multidisciplinary team meetings. The agency is encouraging the health plans to be participatory in the multidisciplinary team meetings, the development of the IFSP. It's important for the health plans to be aware of the services that the child needs to be able to fully coordinate their care, specifically as the health plan is responsible for care for that child, all care, behavioral health, physical health, and additionally therapies, OT, PT, speech. The service delivery model. The service delivery model for early intervention services offers an ability for parents to receive coaching. Additionally, it offers services in that child's natural environment. This will continue to be a component of the service when delivered by our health plans. We've encouraged the health plans not to view the EIS sessions from a purely medical paradigm. The health plans have been encouraged to understand that early intervention services are from an intervention and prevention model. Our contract and our conversation with the health plans continue to encourage ongoing collaboration with the health plans, the Department of Health Early Steps Program, and the local Early Steps offices. This is to ensure a smooth transition and to make sure all parties responsible for this child's care are informed and understand the necessary decisions to be made to make sure that the child's needs are met. Service authorization of early intervention services. The health plans are not allowed to implement service authorization or prior authorization for early intervention screenings or evaluation services. It's important to note that the agency is supporting this, and it's included in the health plan's contract to make sure that we have optimal access. The health plans are also required to do a number of other things. Service authorization has to be met within the contractual standards and contractual timeframes. As referenced on the slide, there are 7 days for standard authorizations and 3 days for expedited authorizations. That authorization timeframe is for the EIS services if a health plan elects to prior authorize the EIS services. However, screenings and evaluation services will not require prior authorization. Coordination of care. Florida Medicaid covers targeted case management for children who receive early intervention services. That targeted case management service is targeted case management for child health services. The health plans understand that targeted case management providers must be trained and certified by the Department of Health through the Early Steps program to be eligible to perform the care coordination for the children who are receiving EIS services. Understanding that these services are required by federal law and require specific coordination consistent with CFR 34. Provider network. Providers of EIS must be certified by the Department of Health, the Early Steps program, and it's the plan's responsibility to ensure that they have an adequate network to meet the children's needs. EIS TCM services. The provider network agreements will be in place to make sure that care coordination for this population for EIS services for children who are receiving these services are in place timely to meet all requirements that are described under federal law and within the plan's contract. Continuity of care during the transition period. The continuity of care period is a period where the health plans must ensure that there's no disruption of services that are already in place. The health plan providers who are providing care to children in the midst of the transition period should continue to provide these services. The health plans must honor ongoing treatment for up to 60 days. The health plans will reimburse for these services. This is identified in the health plan's contract. It's most important to note that providers will be paid during the transition period. Providers will be paid for services that they were previously performing under the fee-for-service delivery system, regardless of whether the provider is in that plan's network or not. This is an obligation of the health plan. Health plans must pay the providers at the rate previously agreed upon for the first 30 days. Health plans and EIS providers are able to negotiate rates. The health plans have to provide training for providers to make sure that they understand how to submit claims in their claim processing system. The health plans have all agreed to make sure that the LESs and the EIS providers understand their billing system, and they will offer the necessary support. Health plans also are required to make sure that non-participating providers are reimbursed, specifically up for 30 days at the rate that was previously agreed upon. Here are a list of resources that you may review to have a better understanding of Early Steps services in the EIS program. The Department of Health Early Steps website has a number of useful links and information that you can review. And additionally, they have policies listed as well. The agency's website contains information about the Early Intervention Services Coverage Policy and the affiliated fee schedule. If you want more information about this presentation, or you'd like to view it again, or want to remain informed of other presentations, you can find it on the agency's website. This concludes today's presentation. We will open it up for questions.